Hi guys, I made my first video earlier today, and since then I've pretty much been studying on and off. I have my pharmacology competency is on Wednesday, which is my first day of classes. The competency is mostly on psych drugs, which is interesting because we haven't covered psych yet. That's what we're doing this semester. So it's my first time seeing most of these. I'm trying to remember as much as I can, especially, obviously all of the classifications, the indications, therapeutic uses, and with so many side effects, I really try to remember things that stand out, things that are different, things that can pose a risk to the patient, whether it's confusion and, could pose a risk of falls, or hypotension, a fluid and electrolyte imbalance, possibly a cardiac event or CNS depression. I try to remember anything that has a narrow therapeutic range, where too little won't do anything, but if you go just past that therapeutic range, right past that threshold, you'll have toxicity. And then obviously with that, any signs and symptoms of toxicity and any related labs that would be monitored, anything like that. So I'm really just trying to remember. Here's one right here, actually, dilantin, and plasma levels are monitored. They should be 10 to 20 micrograms per milliliter. So if you go over 20, you'll have toxicity, and if you go less than 10, it'll be too low. So that's really important. And then that carries through to patient teaching and teaching your patient about this and how they need to be very strict with their, their medication regimen and stick to it and take it exactly as prescribed. It's just so very important. Even patients, on Coumadin who have to, or who monitor their INR at home, it's very important with the patient teaching as well. So you need to know what labs are associated with what drugs, and what normal values are, and you need to know about the patient teaching and what you need to teach your patient. Those are the things I pretty much focus on. So I'm just trying to study for this, and I know how they work at my school anyway. Your competency is 10 questions. So the first 5 questions are pharmacology questions. That could be, the basic action, the class, a side effect, anything like that. And of those 5 questions, you can get 1 wrong. The other 5 questions are calculations and dosage questions. You cannot get any wrong. So I think they let you take it 3 times if you don't pass on your first try. I'm not really sure, and I have not had to retake it, so I can't really say what the procedure is for that, but I know that you do get more than 1 try if you need it. So I'm just going to study, and this is my last semester. This is my last pharm competency, so I'm hoping that I pass it and don't have to take it again. I haven't had to, so I guess I'll be studying as much as I can. It's I'm sorry, it's kind of tough to study. I have a hard time studying at home. I have a really hard time focusing, and that's a big reason I'm making this video right now, is kind of to refocus. But I'm also kind of tired, but nighttime is the only time I really have to study. My fiance and I are on opposite schedules, so he works at night and he sleeps during the day. Even though the baby's sleeping right now, I can't leave the house, because obviously I can't leave a 2-year-old home alone. So I'm stuck home, and I have a really hard time focusing. So hopefully I can refocus right now and get a little bit more done before I go to bed. If you're studying, good luck, and if you aren't, get some rest. You're gonna need it. It's really tiring. It's so exhausting. So just get the rest while you can.